This is a sleep aid drug, and it's been on the market for over 20 years. The original studies were, of course, like I mentioned, done in men. And of course, who's prescribed sleep medications more, men or women? It's women. Because women are just diagnosed with sleep disorder more commonly, plus they go to the doctor and get this diagnosis. So then they're prescribed this medication. And what's happened is all we have is that post-market surveillance for women because women were not part of the studies. It wasn't analyzed to see how women would metabolize Ambien uniquely and different from men. So women were prescribed the initial starting dose, and they would wake up in the morning with still grogginess, and they would get into their car and have impaired driving and get into actually motor vehicle crashes, which for me as an emergency medicine physician is not a joke. It is life or death. And so this is a critically important component. So what happened is physicians and patients and pharmacists are all able to go online and put a report in. So you should also feel empowered that if you have a negative reaction or a concerning reaction or an unanticipated reaction to a medication, you can go right online on the FDA website and send that report in. What happens is they start to look at patterns, and they started seeing these patterns with all of these reports about women taking Ambien and then waking up impaired and then getting into motor vehicle crashes. So that forced a really good look into this medication, and they discovered that when you give a formulation of zolpidem, Ambien, to both men and women, the same dose, then by the time the morning comes, say you wait 6 to 8 hours, they were able to check the serum concentration of that drug between men and women. And women still had 2 times the serum concentration compared to men. So they're given the same dose at the same time. And then 6 to 8 hours later, they take blood tests. They look at how much of the medication is still in there. And women had 2 times compared to men.